You are dispatched to the intersection of Main and Vine Streets for a pedestrian hit and run. You arrive to find a 22-year-old man lying supine on the ground and not moving. Witnesses state that the victim was trying to cross the intersection and walked in front of a car that ran a red light and kept going. Law enforcement and an engine company are also on the scene to assist with scene safety and crowd control.
All right, we're going to make sure I have proper PPE. I would most likely be wearing gloves. I would also want to check if my scene is safe. How's my scene?
Safe, yes.
Okay. My patient's magnitude of injury is vehicle versus pedestrian. And how many patients do I have?
One.
Okay. And I would initiate or call ALS and initiate C-spine position. My general impression of my patient is that he got hit by a car. He's 22 and he could possibly have some severe deformities. How's my consciousness of my patient?
Responsive and answers questions appropriately.
Okay, and my patient's chief of complaint?
Severe left leg, hip, and back pain.
Okay. We're going to go ahead and assess your airway to make sure it is clear and patent. Okay. How's my patient's airway?
Open and patent.
Okay. We will also wouldn't need to insert an adjunct since he is conscious and his airway seems clear. I'm checking his breathing, how his breath sounds are, and making sure he has an equal chest rise and fall. How's my patient's breathing?
Normal rate, non-labored, equal rise and fall of the chest. Lung sounds are clear. SpO2 is 94%.
Okay, we'll just go ahead and then insert a nasal cannula, put it on 15 LPM. We're going to go ahead and check your skin condition. How's my patient's, how's my patient's pulse?
Radial pulse is rapid.
Okay. My patient's skin color and condition?
Cool, pale, and dry.
Any major bleeding?
No major bleeding seen.
And any signs of shock? No signs?
No signs.
Okay. I would just want to put a blanket on him in case he does deform some shock. We're going to go ahead and take his history. I'm going to go ahead and check his blood pressure. Okay, go and lift your arm. Thank you. This is much better now. 93 over 140.
106 over 76.
Okay. Oh, sorry. Just gonna move that. I'm gonna go ahead and check your pulse. Got about 16 breaths per minute, and his pulse is 89.
Okay, pulse is 112 and respirations is 18.
What are my patient's symptoms?
No other signs seen.
Okay. Any allergies? Oh, before I move on, we're going to go ahead and check his pupils, making sure they're pearl. How are my patient's pupils?
They're good.
Okay. Does any allergies?
No.
Medications?
None.
Current and past medical history?
None.
Last oral intake?
Lunch approximately 15 minutes ago.
Okay, and events leading up to this?
Walked in front of a vehicle while attempting to cross the road.
All right. Perfect. We're going to go ahead and start doing a head-to-toe assessment. I'm going to go ahead and touch your head. Are you okay with that?
Okay.
All right, I'm going to inspect and palpate the head, checking the ears as I go along. Go ahead and open your eyes. We'll just make sure they're still plural. I'm going to open your mouth and checking your nose. Okay, how's my patient's head?
No injuries noted.
Okay. I'm going to go ahead and check your neck, making sure if there's any cervical spine is injured or not, any JVD, or if the trachea is extended.
No JVD, no tracheal shift, no obvious deformity.
All right. We're going to palpate the chest and also inspect and oscillate the chest. Sorry. Okay. I'm done palpating and inspecting it. Going to listen to it to make sure if the lungs still sound good. Just breathe normally. Perfect. How's my chest?
No injury noted. Breath sounds are clear and equal.
Perfect. We're going to palpate the abdomen and make sure to take note of all 4 quadrants. I'm going to be careful since most of his injuries are on his left side. Okay, checking the pelvis. I'm going to take mind of his hip. Probably won't touch it since it's in pain, and would check the genital area. How's my patient's abdomen, pelvis?
Unstable left hip. Abdomen is soft and non-tender in all 4 quadrants. No genital injury.
Okay, we're going to go ahead and move on to all 4 extremities. Going to palpate and inspect. Can you wiggle your fingers for me? Which finger am I holding on to?
Pinky.
Perfect. Okay, I am going to just go ahead and palpate the lower leg and avoid his injury so we don't create any further pain. Do you want to go ahead and wiggle your toes for me? Awesome. And which toe am I holding?
My big toe.
Okay. And go ahead, palpate and inspect. Wiggle your toes. Which toe?
Pinky.
Check the other arm. Wiggle your fingers. And which finger am I holding?
Thumb.
Okay, how are my all 4 extremities?
PMS present in all 4 extremities. Left femur swelling and deformity to the left tibia fibula.
Okay. Probably would stabilize his upper left leg, stilt it, or stilt it, wrap it, make sure it won't create any further injuries if he moves. I would also palpate and inspect his back and his buttocks once we get more people. Can't do it now since it's just me. Reassess every 5 minutes, as well as checking his vitals every 5 minutes, and we would also need to do an immediate transport. Yeah, that's it.